Hello, All-Star clients, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while also having some fun along the way.
Just a little bit. Right.
Yep.
Okay. On today's episode, we have myself, co-host and associate veterinarian, Dr. Ashlyn Duckwall, director of surgery, Allie Cook, associate veterinarian, Dr. Jessica Jones, and as always, my co-host and head veterinarian, Dr. Emily King. Woo! And the crowd goes wild. All right.
Okay.
How are you guys doing? It says here in italics, feel free to ask them how they're doing. How are you guys doing? I'm not supposed to read that part, I guess.
I'm actually doing great because this is my day off.
Yeah.
So woo-woo.
So you had a good day off.
I had a good day off. Spent time with my baby.
Thanks for coming in.
Yeah,
Thanks
your
for
day
coming all
off.
the way to work for
That
your
is
day off.
for a day off.
Yep. Allie,
I'm
you
good.
doing all right over there?
Today was not a bad day.
I feel like we're going to pay for it later when it's
I know. I have a feeling too because
Yeah.
everything has been nice and
steady.
Yeah.
steady.
Don't use the Q word.
Like
No.
Yeah,
Yes.
today was a good day.
Yeah.
Lots
So
of learning.
it's kind of back to kind of as busy as like without being crazy busy.
Which is interesting because we're getting into the warm summer season where it's
Yeah.
usually off the charts.
Yeah, maybe it's the calm before the storm then.
Yeah.
That's what I'm thinking.
We should just say it out loud now because it's going to happen. So
Yep.
the storm is coming.
That's
Icebreakers. Okay, girls. Here we go now. Okay,
You go first? Okay.
You
What
ask
is
first.
something you absolutely hate doing, Duckwall?
Grocery shopping.
Really?
I hate it. I do
agree.
not get
That's a good one.
motivated. When I'm there, I go as fast as possible. It's not calming. It's not something fun to do.
Mm-mm.
I am in the
hate
same boat.
Yep.
I do hate that too.
It's the first thing I thought of.
Something you hate doing grocery shopping. I get that.
Yeah.
That's a good one.
APC, what about you?
Laundry. Like, it's not even so much like putting in the washer and dryer. It's like putting it away.
Yes. Yep. Because
You have
even
to
the
fold
folding
it,
it is, if you can distract yourself with good trash TV or something,
Yes.
you know, it's fine. And then you have to put it away.
Yeah, it's not a hard task. It's just,
I think it's hard.
it's just,
You know, the problem is it just comes back around again.
yeah.
It's never ending.
It's never ending.
You do it and you're like, yeah, I finished it.
Yeah.
And in 48 hours, you're like, what the hell? Richie, this is like a perpetual comment from him because he does all the laundry basically. And he is like, I just put away this is how he says it. I put away every stitch of clothing. It was a great day. And then the next day he'll come around and he'll be like, no, he goes, I did every stitch of clothing. I did every bit of laundry. Every stitch of clothing is done and put away. And I was like, that's awesome. And then the next day he'd be like, how do we generate so much laundry? And I was like, I don't know.
You could just be like Charles and never put it away.
Yeah.
He's got 2 laundry baskets
Bingo.
full.
That's how.
I'm
That's
like,
how
oh
my kids
gosh.
are. The boys are. Yeah.
Yeah.
They just
Live out
leave
of
it in their
laundry
basket.
And then they ask where the clothes at. And you're like, look in the laundry basket. It's not my problem as soon as I fold it.
Yep. It's
Or-
in the basket.
Or they need labels for the baskets
Yeah.
because
That's a
they
good
shift
idea.
through them so much. Then it's like, which is clean, which is dirty.
I should line up baskets on Evan's side and just be like pants, shirts, and underwear.
Who needs drawers?
Closets. No
Who
way.
needs it?
That's
Just have
extra
baskets.
effort. So
Yeah,
it's going
I
to turn into
agree.
trash bags.
Yep.
Just
Yeah.
put all in trash bags.
For sure.
What do you hate doing?
Oh gosh. What do I hate doing? Well, I would say cleaning the boys' bathroom. When I have to do it, if I have to do it in between when Annie does it, then that is the worst.
Mm.
Because they don't
Aren't they
peel
all
the
old
toilet.
enough now? You don't have to do that.
Yeah, I know, right? No.
Trying to help you out here.
They always can't hit the toilet. So it's like
Poor
always
Dr.
peeing
King.
around the toilet,
Yeah.
on the lid of the toilet, behind the lid of the toilet. I'm like, are we asleep when we're peeing in the toilet? Richie always was like, we need just like one ginormous urinal in here. And then we wouldn't have to worry about it.
Yeah, there you go. Honestly, after your third boy, you probably should have put one in.
I know.
Been worth the investment.
I know, exactly. So that, and I think cleaning out the litter boxes. I don't know why. I hate scooping the litter boxes.
Yeah. It's
So-
something about cat urine just smells awful.
Yeah, it does. So,
Oh, great.
yep.
Yeah, those are
That's
good
the list.
answers. Great answers. Okay, number 2. What is your most treasured material possession? Allie.
Oh, golly, why'd you gotta start with it? Gosh, I don't know. Like, I don't want to be a millennial and be like, my phone, it's so important. So I feel like I should pick something else.
But that's how you really
But that's
feel.
really what it is.
Everything's there. Like, I'm directionally challenged, and I would probably get lost. Not probably. I will get lost.
Remember when it was MapQuest days?
Yeah,
You had to print
Print
out
it
just
out.
the line by line item.
I would definitely get lost. with that.
MapQuest days. Remember when there was actual maps you had to use? Like there was no MapQuest. There was no computer to look up you had to actually get the map, and then you actually had to stop on the side of the road and ask the people, "Am I going in the right direction? I'm looking for this." Oh yeah, you need to go up that way and then take the first right and then take the first left. Go down about a half a mile and you'll see it on the left-hand side of the road. Then you get about halfway there and you had to stop again to be like, am I going in the right direction?
Because you couldn't remember all the stuff.
Oh my gosh, it was horrible. I don't know how we got anywhere far.
I was stuck in the hills of Kentucky once with a map, and it was just all the way across our dashboard. And I was like, I think we're here. It was horrible.
Yep. No one knows how to read a
Stressful.
map anymore.
So stressful. I don't like getting lost.
But I'm keeping those skills fresh for when everything goes bananas and we have no electricity because of whatever happens and the cell towers go down because of 5G, whatever.
Because of 5G.
And I will know how to read a map.
That's
so
right.
you guys can come with me if I have to go anywhere. If we have to go anywhere. Okay.
Okay. So your phone.
Yeah, I mean, I was always told you're never lost until you're out of gas, but gas prices are high.
Yeah.
The tank's
so-
only going to get me so far.
Yeah. Okay.
Jones, what about you?
Well, the first thing that came to mind was a pic from my first concert I went to.
That's awesome.
But I actually don't know where it is.
No, not really.
But then I thought about it a little harder, and actually, my stepdad got me a necklace that was made for my wedding, and it is gorgeous. So that's pretty special.
Yeah.
That's very cool.
Mm-hmm.
One of those that you love it so much but you don't want to wear it all the time because you want to
Yes.
lose it or
Yes.
break it or whatever.
I'm like, oh, is it on?
Yeah.
Is it on? Mhm. Yeah,
That's very cool.
it's really cool.
Duckwall?
I don't know. I was thinking my coffee maker to make a joke because I really can't live without my coffee maker. And then I was like, okay, that's not real. That's a lie. I don't know. My cat ring. I love it's from one of my best friends and it has cat ears and cat paws and I always have it on.
So it's
I'd be
is
really
really
upset
cute.
if I ever lost it. So we'll say that.
okay.
sounds
Well, that
good.
works.
It's really cute.
Mine's my hat. This is my lucky Tennessee hat. It's my most prized possession.
Why is it lucky?
I don't know. I just feel like it brings me
Did you
good luck.
Oh, okay. So it's not like, okay, I always win basketball games with it on, or I
No,
won
my
the lottery
life.
with it on.
No, my life is amazing. So it's because of this hat, I think.
Yeah. It's so clean.
It
They
is
keep it so
not
clean.
clean. It is so trashed. It gets dirty in the lake and
Do you just
it's
throw
got
it in the washer?
fingerprints on it.
Fingerprints.
Fingerprints.
And it has to
on
be that one.
This is my favorite one, my favorite Tennessee hat.
Okay. So
Yep.
it can't be a different
I
one.
think because I got it, Richie got it for me at some point when we were going back and forth to Tennessee, and then I've just had it for so long, and I feel like it's
Yeah. Is the
brings
visor
joy.
do you feel like it's cooler on your
Yes,
head? Because
I
it's not
do.
the full hat. Yeah.
yeah, for sure.
It's like the best of both worlds.
Yeah.
The sun's out of your eyes, but it's not too hot.
Yep. Exactly. Yeah.
When I think of you, Dr. King, like on vacation or like not at the clinic, I imagine you in the hat. Like,
In this hat?
like someone talks about you and you like think of someone. how they
Remember we
look.
dress up like her.
This is it, me in the hat.
Yeah,
That's
we
right.
We nailed
exactly.
it.
Exactly.
We did, for all those listening, we dressed up exactly like Dr. King for the Christmas party. We wore
It was
plaid
hilarious.
type button up shirts and then a visor if you had it. It's good.
Yeah, and then Faust dressed up as me as.
Oh, yeah. She did the basketball player.
That was hilarious.
That was awesome.
Oh my god!
I was not expecting that one.
No, I was not. I did not understand what was going on when she came in the house. I was like, okay. And then somebody else came in polls, and then Harrison's like, do you get it? And I was like, what are you? And then I was like, oh, okay, I get it now.
That's awesome.
Yeah.
That was a good idea. Good surprise.
It was a good surprise.
Okay.
Case sharing time.
Case sharing. We should have like a sound. Dun, dun, dun.
You did it.
Scary. It does sound a little ominous.
Oh,
I
gosh.
don't know. That's not my job.
Who wants to go
Figure that
first?
out.
Case sharing.
I will. So we had a case today. It was our first time doing the procedure. So the cat actually had a stricture in his urethra that was making it.
What is a stricture? Question. What is a stricture?
Okay, I'm not going to go medically because that,
Why not?
like it's just thin.
Yeah.
And can't pass urine as easily through it.
Okay. Just making sure.
A narrowed area.
Yes.
Yes, narrowed area. That's better.
According to
Better.
Webster's Dictionary.
According to WebMD. I'm just kidding.
So we had to do a procedure, call it a PU surgery, to redirect his urethra so that he can urinate. And it was really cool.
We made his urethra bigger.
Yep.
Yeah.
So
Because cat urethras are so
Male cat
Male
urethras.
cat. Sorry. Yeah.
yeah,
They're so tiny.
so tiny. So yeah.
You need to get out special goggles. To
Oh
zoom
my
in.
God, that was horrible.
You can like barely see it.
Yeah,
It's
Yep.
tedious. It was cool. Dr. King did balla.
thank you.
He's
The
doing
cat's
good.
doing great.
Smokey helped.
And he urinated.
Yay.
We checked the box. We were like, "Is that
Nice.
urine? Is that not urine?"
Well,
so you
he
saw.
didn't make it all the way in the box.
Oh, okay.
Oh,
That's
But
okay.
he did urinate, so
That's exciting.
That's
awesome.
very exciting.
Was there a lot of blood or anything in it?
it was on blankets, so you can
Okay.
tell.
Yeah.
That's
It
huge.
was incredible.
There you go. Now you can sleep tonight.
Okay. He was blocked 6 weeks ago, and a surgery was done, and then he was referred to us because not every clinic will have people that can do the perineal urethrostomy, and so we have some people here who are doing it, and so we said, sure, we'll take the case. And so we took the case and we brought him in last night and relieved the obstruction, and then brought his kidney values down, and then took him to surgery today.
You saved him.
So we saved him.
That's really
Yeah.
cool.
Hopefully so.
Yep.
All right, Phyllis. I know. Yeah. Those are interesting cases.
Yeah.
We were talking about it because everybody was saying, well, when's the last time we've done one? And we just haven't had to do one in so long because of the diets, I feel like.
Yeah.
Back when I was growing up in Granger, learning how to practice medicine, I felt like we did them much more frequently. Like, I mean, you would do a handful a year, kind of
Did
a
you
thing.
just like automatically do it before the diet?
I mean, because the diet,
Right,
you,
it just
you were
happened again.
stuck. I mean, you had to get the crystals and all that
Yeah.
stuff out of there. And so, you might do a cystotomy, but then they would just reobstruct. So
Yeah.
you would just open up their urethra, and then that way they could urinate out the debris.
So
But then now,
interesting.
since the diets, we haven't had to nearly do as many.
Thank goodness.
I know.
That's great.
We've saved a lot of penises.
Yeah.
Those diets.
Saved a lot of cat babies.
We've saved a lot of Hills. Good job. Brocaden, good job.
Yes. That's
Oh,
hilarious.
gosh. Jones, what about you?
I was trying to think. I'll go with a case that was a double cryptorchid because I heard that no one has talked about what a cryptorchid is before
Right.
on the podcast. So I had a double cryptorchid. So that meant his this young dog, male dog, his testicles hadn't descended. So we had to go get them out of his abdomen.
So they're actually in there. It's not that they're not there.
Yes,
Right.
we found two.
Don't be fooled. People will tell you, oh, they're not there. They are there.
They are there.
God puts them there in one place or another.
Yep.
And we
They're
need to
there.
get them out.
Yep.
Yeah. So they can't have babies. And also to prevent cancer.
Yep.
Because if they stayed in the abdomen, they'd be big trouble.
Yep.
So we did
Absolutely.
that. I did have to see that dog this week. That's what reminded me of him. And he, I think, maybe has some other congenital abnormalities, meaning he was born with some abnormalities. His hips aren't quite normal. We think maybe there's some other things going on, but he was a little painful. So we'll see how he does on his medication.
Very cool.
Yeah.
So like going in for the crypt, like that's obviously not a standard neuter, right? So a lot of
Yes.
people see the neuter as like a simple, quick, but this
We went to the abdomen.
Yeah.
It was a lot tougher. And he was a little more painful on his recovery because there's some studies that came out that said going in through kind of the side of the abdomen versus just kind of the middle is a little bit easier to find both testicles when you have two that are in the abdomen. So we went in the side. I do think that might have made him a little more painful, but I think it was a quicker procedure because of it.
Yeah. Very cool.
Gotta get those suckers out. Always causing trouble, you know?
That's right.
Oh, it's just me. So this is a recent one, yesterday recent. We had a newly adopted pitty girl come in. She was super sweet. And she was in a rough situation prior to this new owner. And so she came to this new owner with a severe limp in her back left leg. And so right away, because she was thin, so right away you could just see that her hip joints didn't look like standard. And then when you started to try to feel it, she was just so painful and uncomfortable. So of course we gave her some happy sedation meds and took x-rays. And unfortunately, so there's a ball and socket joint with the hip, and there's also attached to that ball part of the bone, there's a little neck, we call it, so a little piece there. And it was completely disoriented and not normal. It looked like the bone, we assume or we think there was some sort of injury and it didn't heal appropriately. And so because of that, obviously, she's been trying to use it and can't, making it worse. And other things you worry about in a young dog is, okay, was it a congenital disease or is it like a severe cancer, which is not on top of our list for a young dog. So
Or traumatic, right? I mean, like fractured or something like that.
Yeah. So anyway, the treatment of choice is you actually cut off all of that bone and get rid of it and allow the body to form a callus, I guess,
it's like
around
a false
the joint.
joint kind of thing. Yeah.
And they can still use their leg. You don't have to take the full leg. And so she's on pain meds right now until we can get that done. Very interesting.
I remember learning that in vet school. I was like, you're just going to cut the whole bone off and it's not going to have a joint anymore. And that works. But
It's fascinating
it
how the
does.
body just like adapts and then.
Well, there's just so many muscles that hold it. It's just fascinating.
so cool.
Yeah.
And that they can just walk on it and then they seem okay with it.
That's really cool.
Yeah.
It's crazy.
It's what we call a salvage procedure. So we obviously don't do that unless we have to, but it still is a great way of improving their quality of life.
Oh, yeah.
Because they're so miserable. Well, like your dog who was not walking on there,
Just bone on bone.
or if the dogs luxate their hips, you can't put that back. I mean, you could put it back in, but it comes right back out.
Yeah.
Because the ligament is torn. So it's just a great way they get to keep the leg.
Yeah.
So it's pretty cool.
4 legs are better than 3.
Yep, absolutely.
So I've heard.
My case is a Newfoundland, 8 years old, something like that came in from another clinic as well that was sent to us because on his x-rays it looked like she was having trouble potentially with foreign material or gas buildup in her bowel loops. And so they had sent her for an ultrasound. And then on the ultrasound, we couldn't really determine what was going on except for that her x-rays said that she needed surgery. So her x-rays were very diagnostic for surgical intervention. And so we were like, yeah, we don't know what's going on, but we need to go in and do an exploratory. And so then we did. And she had a torsed colonic torsion with a secondary mesenteric root torsion.
So rare.
So
So
crazy.
rare. Yep.
It was basically just twisted.
It was all twisted on itself. And so then obviously the gas couldn't get out. And so the gas was building up like a balloon.
It looked like a balloon.
It felt like a balloon.
Yes.
And so then we had to untwist it, and then which made it a lot better immediately. And then we tacked down the colon next to the pelvic canal, next to the bladder, so that hopefully kind of keep it where it's supposed to.
Place. Keep it
And
where it's supposed to say.
thankfully the owners were like all on top of it. They're like, yes, let's do this right away, because most of those turn out so poorly.
Yeah.
Like they usually don't do well because of the torsion, then all the secondary problems with relieving the torsion. And so that dog was just really lucky.
Yeah.
It was really a neat surgery though.
Yeah.
It's very good on the owners to just like
Do
get
it
after
now.
right away.
Yeah.
Yeah. Because it would have been really bad.
Really bad in 12 hours, even 24 hours
cool.
for sure.
Yeah. Yep.
So that was my interesting case.
Yeah.
It took 2 sets of hands too.
Yep.
Dr.
Duckwall helped me.
Duckwall was in there. Yeah.
Everybody was in there. We had so many.
Everybody was in there at one
At
point.
first, we're just like, what is happening?
Oh no! I know exactly. Yeah,
This
it's
isn't
like-
right, but I don't
we're
know
like,
what
this
it
is not correct. So where is everything supposed to be?
Yeah.
Oh gosh, yeah,
Animals are amazing.
yeah,
It's crazy how much they can deal with.
It is. And survive.
Stronger
Absolutely.
than people.
absolutely.
Better than people.
Yeah, that dog woke up like, oh,
I know.
Yes.
I know. It was crazy. She was just sitting
Nothing
there.
happened to
yeah, I know it. And then she wanted to eat that night. And she was like, "No,
She
this
was
is. I don't
funny.
know what you guys are worried about." It's so
Oh,
weird.
great. I don't have to fart anymore.
I know. Gosh, it probably felt like she had to fart and then she couldn't because it
Yeah.
couldn't go down.
did it smell like farts for the
Oh,
whole
yeah.
day?
Yes, she was. I mean, gas definitely came out.
Yeah. Oh gosh, and she had eaten bark. That's what
Yeah.
we think caused it.
Ugh.
Is maybe the bark was like in a horse when it would be like heavy, like sand, like you know what I'm saying?
Oh,
Like
yeah.
I wonder if there was
And
something
it, like caused
yeah
some type of like reason to flip.
because of the weight of the bark. I mean, it felt like don't you think Duckwall? It was like
There was so much. Like, just all in one.
I just don't know if it
String.
created a heaviness to it. I have no idea. Who knows?
And then like light and heavy because like all that gas. Maybe,
Maybe it
yeah.
just flipped. I don't know.
That's cool.
So weird.
Yay, it lives.
Anyway.
Saving lives.
Saving lives. We need a saying like saving lives and no. I don't know. I'm not creative. So I
Taking
can't come up with it.
names. Saving lives.
Something better than that.
I don't know.
Oh gosh. Okay.
I'll think about it.
Okay, you think about it because you're way more creative than I am.
Yeah, I'm so great.
We're about the same, I think.
I was going to say. I don't know
We
what you're
need
talking
somebody
about.
else much. Okay. All right, on to client questions. How do you best address resource guarding, particularly guarding that has turned into biting when being disciplined? And this question comes from Sarah Burnette. We're going to just turn it over to Allie Cook now.
Here is Allie cooking.
And here's Allie Cook.
us.
All right, we'll be back in about 15 minutes. Thank you.
Okay, I have a note sheet here.
Wait, we should introduce her. She's a
Yes.
trainer.
Yeah, well, yes.
Yeah.
Tell them a little bit about your
Yeah.
credentials.
And your interests and all that.
Well, I have an interest in positive reinforcement clicker training. So only using positive methods to the best of your ability. As far as resource guarding, this is going to be a very broad way to kind of go about fixing it. By all means, the first thing that is the most important is safety. So you don't ever want to intervene or take an item away from the pet or food away from the pet because that can end in injury. Secondly, is to know the dog's body language. So the dog goes through multiple things. So the dog could have been showing signs way before the biting behavior started. So like lip licking, hunch behaviors, avoidance, different things like that could have been signs.
What about where they hold the treat and stuff? Like, is that a clue too?
Yeah, like are you meaning like gripping the toy harder?
Yeah. Or so they're chewing. So like say the toy's in front of them like this, you know, like they're sitting like Phyllis, for instance, and they're chewing. You walk up to them, they stop chewing,
Yeah, or like clamp down
right?
on it.
And then can that be one?
yeah.
Okay. Yeah, because I feel like, why? Why are you laughing? Because then you
like,
get
could
like,
that be one?
I mean, because feel like I see that all the time. They're like chewing,
Yeah.
and then they stop and they're like,
They do the side eye.
Yeah.
Side eye.
the side eye. And
the
it's like, they're going to
side-eye.
get ready. They
Oh.
don't want you to take it away from them, you know, kind of a thing.
Right. Yeah. That is definitely one of the cues for that. Sorry, I really have to look at my notes because I
No,
don't
it's
wanna
good
miss
because then you
anything.
won't forget any points. That's
Yes.
good.
Third thing to keep in mind is you really don't want to punish this behavior because the dog is already biting. You run into the dog becoming worse, or the biting gets worse, or the resource guarding all in general gets worse. So I'm not sure in this particular situation where the resource guarding is happening. So I don't know if it's with people, other animals,
Food, toys.
yeah, food,
okay.
toys. So that all kind of plays a role in when we're dealing with resource guarding. So one of the things to start with is just IDing the situations and the resources that are being guarded and keeping like a diary of that. So that way, if you do seek out professional help, you have things written down to go from, and then you can get better help when knowing those things.
So would you say that most people would? So their dog they go to take something from the dog and then they just grab it anyway. That's what they're doing.
Yeah, I can see that.
Like, so the dogs, I don't know, like you drop something and then they claim it as theirs, and then you go to get it and they're growling, and you're saying people shouldn't stop right there.
Right. Yes.
Don't go ahead and grab it.
Don't go ahead and grab it. That is asking for injury. I believe there were studies done that actually, like, a lot of people think that's a dominance behavior, but really it's not. It's more stemmed in like a stress or anxiety, or there's medical reasons why the dog or pet could be doing what they're doing. So there's a lot of reasons why resource guarding could be happening, changes in the environment. So there's just a lot that goes into it before you can really pinpoint why they're doing it.
Gotcha.
Yeah. So methods that you can try are drop it. So teaching the pet to drop it while you're reinforcing with a higher value treat. You can teach relaxation, like on a mat, so like a place. So you're giving them or redirecting, letting them know that they can relax in a different spot. So are they resource guarding in a certain place? Is it in the kitchen? A person? So teaching mat or relaxation, you're kind of allowing the dog another space. And then leave it is another good one. So if they're resource guarding, your kid drops a chicken nugget and you don't want them to have it, leave it would be a good thing to have. And then you're just reinforcing with something of higher value. And then one thing to keep in mind, it does take consistency and a lot of training to deal with resource guarding. You may need a lot of maintenance and management to help the behavior. And sometimes in some cases, there's not really a cure. It's just mostly management. So it can
avoiding situations that
set yourself up for success with your pet rather than creating a negative situation and start to change it.
Yeah, I think Zak George is a great positive reinforcement trainer. He has an amazing book and then also great YouTube videos as well. But I will never forget, he said, like, anytime you're doing training with an animal, no matter what it is, make sure you are in control of the environment. So if you're trying to specifically work on food or something, or for example, if they're resource guarding a person, you want to be in control of who's going to be entering that space during that time of training. And so you can be prepared and then therefore prepare your animal. So I think that can get a little chaotic sometimes depending on the trigger for the dog or how busy their environment is. So literally having a separate space for that is really helpful.
And maybe having everyone in the house on the same page. Yeah. So like this is training time, and sometimes you can maybe involve even kids with training time if it's not dangerous.
Yeah. Yeah. But definitely controlled. And then just seeking out professional help as well, like a behaviorist. If you don't feel comfortable, please don't try any methods at home. We don't want anyone to become injured.
So in a puppy that's resource guarding, would you say it's fair to say if you work with a puppy, usually you can train them out of it?
Probably has a higher chance of doing so. Definitely with the higher rate of reinforcement. If you get them out of that habit, stop the behavior so they don't have time to practice that behavior, I think you would have a better chance of redirecting that behavior.
Right. Okay. So let's walk through a scenario of a dog resource guarding and what we would do, the steps we would do.
Okay.
Harrison, do you have an example of a situation?
Your dog's perfect.
like a real life example. Do you know what I mean? That we can walk through.
Allie, by the way, you rock.
Thanks, buddy.
He's so smart.
He's so smart.
I love when I can be like, Allie Cook will call you back. She's great at training.
You are really good.
So So here's the example. Okay, you have two dogs, right? One's smaller, one's larger. The smaller one really likes bones. He likes chewies. And whenever he has chewies around, he resource guards them heavily to the point of growling or even nipping the larger dog. The larger dog will run away, doesn't try to have any dominant behavior over the smaller dog. And when you try to take away the chewy from the smaller dog, he bites onto it hard, he doesn't let go, and he sometimes growls a little bit.
And he runs away sometimes?
Sure.
This is just a made-up situation.
There are so many details.
I know.
I'm so impressed at how this was a made-up situation.
Okay, so let's talk about how we asking for a friend. Tyler, how would we address the situation?
I think first, start with management. So what can we do to kind of control or stop that behavior right away before someone or the other dog gets hurt. So as a management tool, maybe you do start with the relaxation mat or give the dog a place where chewing the bone is acceptable. So that way you can kind of manage your dogs. Or if you have one dog, the smaller dog's out chewing a bone, maybe you have the other dog in the kitchen until that time is up or until you're able to get the dog to drop it and leave the bone in that situation.
Okay, so they can have the bone, but it needs to be in a situation where they can't get in a fight, or where the other dog's put away, or the other dog knows I don't approach the other dog when he's on this mat or whatever.
Right.
Okay.
I've also always been taught if it's like a person to the dog when they have something and they're protecting it, like something they know that the dog know they shouldn't have, like a sock or the bone, you want to do a trade-off for it. So you can't obviously go in and just take it away. That's going to reinforce that protective behavior for the dog. So you try to find a high value treat or distraction, or say like, if they like the word walk, or they like, I don't know, something like that.
Someone even said like you could even, let's say you're in danger, you could ring the doorbell.
Oh yeah,
like
that's
really
good,
like a
just to
alert.
literally get them out of a haze or something. And then obviously, I also read too, like if you're getting them to you, you don't reward them right away. You also then ask them to do something you want them to do. So sit, maybe walk a couple steps, sit again, and then reward them and give them a treat so that they're doing what you want them to do.
So if the dog has something, so if the dog has the chew and the other dog's in the room, and you got the big dog controlled, but now you got to go get the item from the little dog because you're only one person, and you need to be able to take the chews away. No chews for anybody.
Get out of the house. No chews in the house.
You get the other dog controlled doing something in the other room, and you go now to get this chew from the other dog. What is the best way to get the chew from the other dog? Trade of something. So this dog knows drop it or whatever. So you use something of high value and you show it to the dog, and the dog drops the chew, which is great. And you give him the chew, but then as soon as you go to step on the chew, he goes and gets the chew again.
You got to put him somewhere else so he can't see it.
So you walk him away from the chew. He's going to go get the chew and bring it with him. So do you try and be faster than the dog and step on the chew and then just treat with the high value thing and keep your foot on the chew? Is that what somebody's supposed to do?
I probably wouldn't recommend that because
asking for a friend.
I can see, like, I'm just trying to see like the worst case scenario. I can see where the dog would start to attack your foot, maybe if it's that bad.
If it's that bad of a dog, okay.
So I would recommend redirecting. So what I mean by that is if you have a high value treat, so say it's hot dogs, like you can't just do like kibble or something like that. It has to really mean something to the dog. Or cheese or something. I would toss the treat.
Oh,
Make
yeah.
sure
Okay.
the dog
Tossing.
goes and gets it.
And go
We are
fast.
throwing.
And you go in for a sweep. Swiping that. And if you're practicing with a dog, like I just thought of, like, they have those little hand gripper things, like for grocery stores.
Oh, yeah. That's a good idea.
So you could
Genius.
always use that before. Also, like, you could tether your dog in the house so they can't run away and, like, really control your environment. I think that's really, really important.
Oh, see, like tethering the dog. I never even thought that, because you could kick the chew out of the way. Like you could do the treats over here, throw your hot dogs over here. He turns over here, kick the tree out of the.
I can just imagine.
You really want to
Kick it out of the way, out of the perimeter of the tether, and then he can't go get it, and you win.
You win, but training wise, you really want it to be a smooth transition, because if the dog's still like interested, of course it's still going to be interested in the bone, but if you're just playing like a keep away type of thing, I don't believe the training is going to stick in that.
I did read you have them keep coming, like you have a couple pieces of hot dogs, and once you are able to, you read your dog, right? They're calmed down, they're maybe in a completely different room, and you can safely grab a hold of their collar or their harness or whatever they wear, then literally put them in a separate room.
Oh, and then go get the treat.
Yeah.
Is it bad to let them, so they say they did a good job and they came with you and they walked those 7 feet and you did the reinforcement every couple of feet or whatever, and they're like forgotten now about it. Can you go ahead and let them go back to it?
I mean, you can. I mean, I think it all just depends on
And
the
then
situation.
do it again, like train it again.
Right.
Do you know what I mean?
Can,
And use
absolutely.
it like
But if the dog is ramped up and you're like just running this for the first time and the dog's still like looking back at the treat to see if it's still there, it's taking your food, but it's still fixated on the bone, I don't think you're quite there yet to be able to
Let
give
him go
that
back. Yeah.
reward, to try to do that scenario multiple times.
Got
if
it.
that makes sense.
So put him in the other room, shut the door, go get the bone, put it up so he can't even see it. Let him out of the room, and you're good.
No chews ever again.
Exactly.
Sounds like a
Do
hassle.
I mean,
just-
that I'm just thinking if you're
And,
by
like,
yourself,
severe and-
if you're a person by yourself, what do you? I mean, you know what I mean. That's what I'm trying to think.
Right.
Like,
I'm
I'm
just
trying to
thinking-
be a client at home, going
No, it's
Yeah.
real scenarios. Very real scenarios.
right.
I'm just thinking of if it's a bigger dog and it's fighting you on it. Like at this point, you're just getting the chew. I don't feel like the training's really an issue. And if the dog is destructive, he may try to bust out of the door. But that's just me playing devil's advocate
Yeah,
and
that's
kind
a
of
good
giving
point.
worst case scenario. So
Okay. And then you could teach. I mean, but the drop it command would be the
yeah,
That's
your
the
long
best
term
thing
solution.
I've ever taught
Yeah.
her is leave it. Because she can be across the yard.
You could
She's
be
got
like,
some in
yep.
her mouth. I'm like, leave it. It's
Yeah.
the best thing ever.
No, I agree. Those two commands are fantastic. Drop it and leave it.
in place, like you
Yep.
had mentioned, that
Yep.
one's really helpful too, because if place is further away, now it doesn't make them drop it, but
Yeah.
maybe drop it with place too. That one's really nice to have. The one you mentioned.
yeah, that's a good way to do it too. Have
Allie,
teaching that
talk
behavior.
for a second about the fact that if you punish, like how, like if you're punishing the behaviors, the cues, because they always give you cues before they bite. It's like they always give you the warnings before they then bite. And so a dog, there hardly ever does a dog just bite. So, but you can teach them to just bite by punishing the cues.
Yeah.
So talk a little bit about that. Or is that enough? What I just said.
I mean, I guess, like, are you talking about kind of like threshold? So, like, at first the dog may pin his ears back or lip lick, but then the dog feels like you still are intruding onto his space. So maybe the dog goes from lip licking and ears back to now the dog is growling as an extra warning.
But if you're punishing the growling,
Yes, if you're punishing the growling, then the dog's like, well, I can't do that. So then the dog just bites, right? So I think that's another reason why punishment doesn't do us any good, because it makes the dog worse. And like you said, it's punishing the cues that they're trying to communicate to us. So
because I feel like you hear from clients, like they'll be like, there's no warning. They just bit me.
Yeah.
Now, maybe sometimes they don't know how to read the warnings, but I do feel like people by accident, without knowing they did it, got rid of the warnings.
yeah, for sure.
Yeah,
Like I feel like
that's a
it's
really
like
good
you
point.
they punished the warnings.
Such a good point.
Yeah.
And instead of going, oh, that's a warning, I need to do this instead. I need to redirect. I need to whatever.
Right. Yeah.
Yeah. It's fascinating.
Yeah,
It
I think
is.
it's important. Definitely, if you're really invested in changing the behavior, getting on YouTube or going to a reputable site and looking up dog behavior
Mhm.
and signs, and just, I think it would really help.
We have in our area, some of the facilities like Ultimate Canine, Alpha Canine. I'm drawing a
I
blank.
can't.
What is the behaviorist on Rangeline in Carmel? The veterinary board certified behaviorist.
Oh, Dr.
Dr.
Rick
Dr.
Drink.
Drink.
Yeah. I mean, we have some really good resources
Yeah.
at our disposal to use. And of course, there's Allie. But I mean, she's
And
only one
Purdue
woman.
has a behavior.
Purdue, yeah, as well. But I
Yeah.
think that anytime that there's aggression, though, they're going to, they at least the behaviorist, when we were in school, would talk about we have to identify what forms of aggression there are, because then they address them different ways.
Mhm.
It's not just one form of aggression. There's, all these
Yeah.
territorial possession,
Yep.
dominant, like all these other, and so then they run you through a bunch of questions and to figure out. But I think the whole point is like what you're saying is that there's then you have management tools in place.
Yeah.
And it takes time. I always tell
Mhm.
people, like, if you don't have the time to train them yourself, that's okay. That's what trainers are for. Like, you have to understand where your limits are, because you can't expect it to be fixed in 2 weeks. It's just
Yeah.
not going to happen.
Right.
Because there's regression, changes in environment, all of that stuff. So I always recommend, like, you should talk to a trainer with a serious issue like this.
Yeah, absolutely. Absolutely. Because people come first.
Mm-hmm.
Safety.
I'll also say another great resource that Duckwall mentioned. She mentioned Zak George.
Mm-hmm.
He has a video of a corgi who is an aggressive resource guarder, and he gives him a bone, and he goes through the situations like right there and then of what to do when he does, because the corgi does bite him in the video, and so like he goes through all those real life scenarios as well.
Wow.
So
He's
Very cool.
fantastic.
Yeah.
Great resources.
great trainer.
Yeah.
Awesome.
Follow us, Zak George.
I know. Oh, we should totally.
We should start doing this.
I feel like I talk about him at least once a day
Yeah.
to clients.
Yeah, it's great stuff.
So,
Internship, maybe.
oh, good idea. Okay, yeah, that's
Yeah.
right.
Tag him, whatever you do.
Whatever, yeah, Harrison, however that works. Tag Zak George. Let's get him to call in
Oh,
That's such a good idea.
or come visit us.
or come visit us.
Be
Where
on the
does he work
podcast.
out of, Harrison? What state?
Lives in Alaska.
Okay, that could be a
We'll go
problem.
to him.
FaceTime.
We could go to him. Let's just go to
That's
him.
cool.
and
That'd
say,
be cool.
Take a
We'll send
trip.
you on an internship.
Okay. That would be
so
pretty
cool.
sweet.
Yeah.
That would be pretty awesome.
Wow. Changing lives.
Oh my gosh, that's so exciting.
Visiting Alaska. Here we go.
Have you guys read Dr. Sophia Yin's
Oh,
books
yes.
too? She's wonderful.
She's fantastic. Her, yeah, and that's all positive reinforcement
Yes.
stuff too.
Yeah.
That,
Good stuff.
She's cool.
For sure.
I did the intro. You do the outro.
Okay. All right. Anybody have anything else to add before we close? You think we covered it? I think we did.
If we didn't, then send in your questions.
Send in your questions. That's right.
Call us.
Call us. That's right. All right, everybody. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on social media platforms at All Star Veterinary Clinic. That's stuck in my throat. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
Fireworks.
Oh, fireworks.